My hello and good evening to all of you. This video is about a very important topic, EQ series, which we have selected for today. Topic is epileptic thought phenomenon. Epileptic thought phenomenon. A question was asked in AIIMS exam before INS CT was conducted. I would first like to show you the question. A 24-year-old female with epilepsy gets repeated thoughts to cut off her finger with a knife. Since the student saw it as a repeated thoughts, the first thought that came into their mind is it an obsession? Actually, obsession is a differential diagnosis of this. Obsession is a differential diagnosis. She goes into detailed planning and how to do the same. These thoughts are distressing. So obsession is also a distressing thought. But the most important point here was they do not urge her to do the action, nor does it cause anxiety. This rules out obsession because for OCD to be diagnosed, obsession causes anxiety. The thoughts stay for 5 to 10 minutes, after which she gets a seizure and the thought disappear and don't come back again and she feels better. This phenomenon is called forced thinking. Forced thinking is a pre-ictal thought. What do you mean by pre-ictal? Just before a seizure it appears. Okay, the thoughts are of self-mutilation, just like as shown in this question, and after which it is followed by a seizure, and after the seizure the thoughts disappear. After the seizure the thoughts disappear. This is called as forced thinking. Have a look at what textbook says about epileptic thought phenomenons. Epileptic thought phenomena are of two types, forced thinking and thought crowding. The other option in that question was thought crowding. Obviously, it is not thought insertion coming from outside. So the other option was thought crowding. It came in AIIMS May 2017. So forced thinking is a pre-ictal thought, means just before a seizure. Most common is self-mutilation. The thought is followed by a seizure and the thought disappears after a seizure. So pre-ictal. And thought crowding is interictal, means between two seizures. One seizure, another seizure. In between, the patient gets disorganized and racing thoughts. Disorganized and racing thoughts. I hope you know what is disorganized, loss of inhibition. These are the two epileptic thought phenomenons. Very small topic. This is given in Lishman Organic Psychiatry, page 3010. In partial seizure, patient may experience distortion of thought such as forced thinking, such as feeling of compelled to think about a specific topic. Okay, or crowding of thought, disorganized thought. So there are two types of epileptic thought phenomenon. One is a forced thinking and one is a thought crowding. All of you are supposed to remember that it is not obsession, because obsession causes anxiety. Forced thinking does not cause anxiety. Okay, the key point here was this one, which I have already highlighted. Not urge her to do anything. Is that clear? So many students marked it as obsession. Answer is forced thinking. It might be repeated. Just remember this much about epileptic thought phenomenon. The PDF would be attached below the video. Thank you so much.